For many infertile couples in the United States, the cost of infertility treatment is prohibitive. While many foreign countries, especially those with declining birth rates, subsidize in vitro fertilization (IVF), the United States government has not yet recognized infertility as a disability that warrants greater scrutiny. Luckily for some, however, legislature in 15 states mandates insurers to offer coverage for certain procedures, making infertility treatments more affordable for thousands of families. Per the American Society for Reproductive Medicine, the following states require insurers to provide coverage for infertility treatment, albeit subject to restrictions. Arkansas. Providers cover IVF, but the lifetime coverage may be limited to $5,000. Restrictions apply, e.g. sperm and eggs must not be donated. The couple must have tried to achieve pregnancy for at least 2 years, etc. California. Providers are not required to cover IVF, but diagnosis of infertility may be covered, as well as gamete intrafallopian transfer gift. Connecticut. Both individual and group plans cover medically necessitated diagnosis and treatment of infertility. Restrictions are imposed on patients' age must be older than 40 on the maximum number of treatment cycles. 4 for ovulation induction, 3 for intrauterine insemination left bracket IUI right bracket, and 2 for IVF gift. Zygote intrafallopian transfer left bracket ZIF right bracket, or low tubal embryo transfer, and on the number of embryos transferred no more than 2 per cycle. Hawaii. Plans offer a one-time coverage of IVF at patient expenses. Eggs and sperm must not be donated. The couple must have tried to become pregnant for at least 5 years. Other restrictions also apply. Illinois. Group plans of at least 25 participants offer coverage for various infertility treatment procedures, but more expensive ones are covered only after less expensive procedures have been attempted unsuccessfully. No more than 4 egg retrievals can be covered by insurance. Louisiana. Providers cannot deny coverage for the diagnosis and treatment of coactable medical conditions solely because they result in infertility. Coverage excludes infertility medication, IVF, and other assisted reproduction procedures. Maryland. Group plans of at least 50 participants offer coverage for various infertility treatment procedures, but more expensive ones are covered only after less expensive procedures have been attempted unsuccessfully. In addition, providers may impose a lifetime maximum benefit of 0 and 3 IVF cycles per live birth. Massachusetts. Insurance providers cover medically necessary tests and procedures for infertility diagnosis and treatment, including IUI, IVF gift, and ZIFT. Montana. Only health maintenance organizations that both are required to provide coverage for infertility services as part of basic preventive health care services. The extent of this coverage is not defined. New Jersey. Coverage is provided for IUI, IVF, GIFT, and other infertility treatments if less expensive options have been attempted unsuccessfully. The coverage extends to no more than 4 egg retrievals. New York. Providers cannot deny coverage for the diagnosis and treatment of coactable medical conditions solely because they result in infertility. Coverage excludes infertility medication, IVF, GIFT, and other procedures. Ohio. Only 8 depots are required to provide coverage for infertility services as part of basic preventive health care services, but only when the procedure is medically necessary. The extent of this coverage is not defined. Rhode Island. Insurance providers cover the diagnosis and treatment of infertility if the procedure is deemed medically necessary. Texas. Some insurance plans cover IVF if no other methods have worked and the couple are using their own eggs and sperm. West Virginia. Only 8 depots are required to provide coverage for infertility services as part of basic preventive health care services, but only when the procedure is medically necessary. The extent of this coverage is not defined. Note that even if insurance providers are not required to cover infertility treatment, some of them still do. For example, my state legislature does not obligate insurers to provide coverage for IVF or other assisted reproduction procedures, but my insurance plan offers a lifetime coverage of $5,000. Nevertheless, after certain conditions are met, e.g., more than a year of failing to achieve pregnancy, for those who are over 35, unsuccessful IUIs before an IVF is attempted, etc. Although most health insurance providers do not cover infertility treatments, if they are not required to do so, keep in mind that parts of these treatments, e.g. ultrasound imaging and blood tests, can be considered routine tests, and thus at least partially covered by the insurer. The same is true for generic medication, e.g. clomiphene citrate. Still, the unfortunate reality is that many couples in the United States find themselves required to pay in full for their infertility treatments, and they have to be able to pay the entire amount upfront.